Hello and welcome to your Huddle for December 14th through the 21st. I'm Ricky, your nurse manager. First, I want to talk about patient experience. For this week, I would really like for you guys to focus on updating the plan of care on the patient's whiteboard. A lot of the feedback that we get from our patient surveys identifies RN communication with them in regards to their plan of care. So if we can start being a little more mindful about making sure that that's updated. If you're not 100% on what the plan of care is, always look at your physician's note. You can usually get a pretty good idea of what they're planning for that patient. Innovative team. Last week we worked on the NA expectations, had a great rollout with that. The NAs are also working on updating a checklist throughout their shifts and have had great success with that, so thank you for that. This week the innovative team reviewed charge nurse expectations. Next week we will be going over those and kind of rolling that out with the charge nurses. We will also be meeting with PATH next week to talk about appropriate patient placement, which is going to be huge, so we're super excited about that. And then another rollout for next week is the patient acuity tool that the innovative team has come up with. So here's your sneak peek of that tool. We've identified some areas that we will grade for each patient. So when you get your assignment, the charge nurse will give you this. You can put your patient rooms up here, give them a total grade at the end of your shift. Please turn this in by 5 o'clock to your charge nurse. The charge nurse will then, so you'll give them a grand total at the end. But that charge nurse then will put it in the appropriate room for that patient. So when they're making assignments, it'll help them kind of identify a more fair acuity assignment to each nurse. So there'll be more to come on that. So that's pretty exciting. This past week, as far as safety concerns, we did have a fall that there was a one-to-one in that room. Lesson learned is even though you're in a one-to-one, please just allow that alarm to keep going so that it'll alert somebody to come and help you, and then follow the fall protocol as usual. Staff recognition. December 5th, we had 3 new hires. So we want to welcome Devin Fuller, she's a full-time night RN. Stephanie Wood is a relief RN, and Hannah Hill is a relief NA. So welcome to our team, we're so happy to have you. And then also don't forget about the ornament exchange if you'd like to participate in that. The last day is December 19th, so get your ornaments on the tree, and then we'll be picking names after that. So that's all I have. Have a great shift.